Hi, I'm Gabby Bernstein.
Hi, I'm Dr. Lisa.
Hi, I'm Farnoosh Tarabi.
Hi, this is Christelle Lynn, and you're listening to me on That
Total
Mom
Sense.
Sense.
I want lipsticks for everyone. Even when I was making foundations.
We've been building these direct-to-consumer media brands, and I really thought there was a space for a more storytelling, premium-led video brand for women.
Started a beauty brand out of my apartment, and now to be a Black female founder at Unilever, there's been some incredible key learnings.
Perception that motherhood softens you. Mm-hmm. It has softened me towards them.
Right.
But it has toughened me like nobody's business.
I believe parents have a superpower, our intuition. I call it our mom sense, and it applies to dads too. Hi, I'm Kanika. I love storytelling and a good interview. I began my career as a television anchor and executive producer for CNN. I am now an entrepreneur and podcaster. What am I most proud of? Being a mom of 3, including twins. Tune in wherever you listen to podcasts and on my website, kanikachadagupta.com, and follow me on Instagram at kanikachadagupta. Stay strong and see you soon. In our post-COVID world as parents, we've become highly sensitized to illness and disease, be it new variants like Omicron and XBB 1.5, to common viruses resurfacing and creating a scare like RSV, and of course, influenza, the flu. Many of us have children who are on the spectrum. Autism is the fastest growing developmental disability in the world, increasing at a rate of 10 to 17% each year. As many as 1 out of 150 children is diagnosed with autism, and more than 1.5 million Americans have it. There is one leader in the medical world who is easing our fears, Dr. Gator Warsh. Dr. Gator reminds us of how important it is to go back to the basics, from consuming real food, nothing processed, leading a healthy lifestyle, and even tapping into home remedies before turning to medicine. Dr. Gator Warsh is the leading pediatrician to the stars. Located in Beverly Hills, he's a respected holistic and integrative medicine specialist. Before taking care of famous babies and teens, he grew up in Toronto, Canada, where he was honored by the Canadian Institute of Health Research Masters Award. He was also an entrepreneur, voted Student of the Year in 2009. He moved to the U.S., where he began his career as an attending pediatrician at the Children's Hospital of Los Angeles, where he was honored as the George Donnell Society Research Fellow. He is on staff at Cedar Sinai Hospital, has published research in countless journals on childhood injuries and obesity, and is a faculty member of Peds4U. Dr. Gator's wife is Sarah Intelligator, a Beverly Hills-based attorney with a holistic divorce and family law practice, and was honored as 10 best attorneys in California in 2017, and has even taught yoga for over 20 years. Dr. Gator was given the nickname Dr. Gator after marrying her, and it just stuck. Together, they have a 3-year-old son, Eli. Dr. Gator, welcome to That's Total Mom Sense.
Thank you so much for having me on. I'm so honored to chat with you, and I look forward to chatting about kids' health today.
So as kids, when we're asked, what do you want to be when you grow up? I feel like so many of us, including me, said pediatrician, but not everyone is committed to go down that path and, study for years on end. So what made you actually follow through and become a pediatrician?
I always loved science in high school, undergrad, and I wanted to do something with that. And I also just fell in love with working with kids. I used to, being Canadian, I used to coach hockey. I coached my brother's team, and I just fell in love with working with kids and helping kids. And I did summer camps, and I coached baseball too. And when I went to med school, it was always to become a pediatrician. I always found that, if you can get to kids early, then you can prevent a lifetime of illness, and kids listen and get better, where adults don't necessarily always do that. So, to me, it was always much more enjoyable to work with kids. And so that's why I went into pediatrics.
Are there any tips that you have for the season? I feel like the winter season, because we're cooped up, all these things are going around much faster. So
Yeah. I get the question a lot of why why is this happening? Why are we getting so many more viruses in utero? We don't exactly know for sure. My theory is that, with the last couple of years, we haven't been around as many people. And so these viruses didn't really get to circulate like they usually do. So then there's a lot lower immunity in the community. A lot of kids didn't get, say, exposed to RSV. So if 90% of kids are supposed to get it, or usually get it between 0 and 2, and none of them got it, then now you have all the kids getting it between 0 and 4. And then also, we're not eating as well. We're not getting the exercise that we need. We're not sleeping as well. We're not focusing on these things. And we know from research from 50 to 100 years ago that when they put viruses in people's noses, I don't know who was volunteering for these studies, but the people that didn't sleep as well, or the people that were more stressed out, they were much more likely to get sick. We know this, and everybody knows this intuitively. Like, you had a test, and you're like, right after that test, then you get sick, right? Or you have some sort of stressful event, a holiday, and then right after that, you get sick. Why? Because your body is dealing with all the other stuff. So that is how our bodies work. And because we're not treating them very well, then there's a lot less of a capacity to deal with viruses, infections, whatever it may be. And we're getting sicker and sicker. And that is how things work. Our body, we're like a bucket with water flowing in. I like to say it's like, and the water flowing in is inflammation, and there's a hole at the bottom and things are flowing out. But at some point, if too much water is flowing in, it overflows and our body just can't handle it. And that's what's going on right now. We're being exposed to toxin and toxin and toxin. And then at some point, we just can't handle it anymore. And then the regular virus that would have just caused a minor cold causes something severe, or it turns into an allergy or autoimmune condition or whatever it is.
Right.
We're surrounded by more and more chemicals. We don't have the reserve that we used to have. I mean, we're breathing in air that has chemicals in it. We're drinking water that has chemicals in it. Our food is covered in chemicals. It's sprayed in chemicals. It's preserved with chemicals. It's not even real food half the time. I mean, the food that we're eating, there's no nutrients in it. I mean, we're destroying the soil. We're using artificial products to create our produce. And then even at that, we're then eating things that are preserved. If you go to, I don't know, a farm or wherever, even outside your house, if you have a plant and you pick something off the plant, how long does it last for? Right? Like 2, 3, 4, 5 days, maybe. So when are you getting your food? How many days or weeks after it was picked? The only way that's possible is if it's sprayed in stuff, right? I don't care what anybody says. It's got to be covered in something. It has to be sprayed. The thing took a world trip, was picked in some other country, flown across or, shipped across. Then it went into your grocery store, sitting there for a couple of days, then goes to you. There's no possible way that something wasn't done with it, even if you don't realize it. Maybe it says organic on it, but organic just means it wasn't sprayed in pesticides. Doesn't mean it wasn't coated with other things. You go to, I don't know, Whole Foods and you read the signs. If you look really closely, and it's like, oh, these apples are, wax covered, whatever. Well, you think they're just shiny? No, these things are covered in wax, so they preserve them, right? Even when you think you're eating healthy, you're eating chemicals. So these are just things that we have to be mindful of. Doesn't mean you shouldn't eat an apple, but we're just constantly taking in toxins and chemicals. And so if we don't focus on minimizing them as much as possible, then why would we be surprised that every kid is sick and every adult is sick?
Yeah, absolutely. And then, I mean, do you think that that's probably the biggest underlying cause for endemic problems like ADHD and, lupus, Crohn's disease, autoimmune issues, all of that in kids? It's like, it's the environmental factors more so than the genetics. Right?
Yeah, I think that, in my opinion, and based on what I think and what I've seen, the decrease of the nutrients that we're taking in terms of our food and the increase in chemicals, those two things together, to me, are the biggest factor in terms of the very rapid increase and rise in most of these things. Absolutely, some genetics are involved. There are certainly some diseases that you get which have nothing to do with the environment, or completely genetic. So there's no question about that.
I wanted you to take us through kind of the different phases of a child's life, and like maybe one piece of advice you'd want to give the parents about that. So when you're a parent of newborns, what do you as a pediatrician want us to really be mindful of?
I would start even before that, I would say, because I think even as a pediatrician, I'm working on a book right now, and it's like, trying to go back, and we're starting from baby, but I always want to be like, okay, but we need to start before that, right? And that's the problem with the pediatrician, right? It's like, okay, this is great, but like, yes, we get the baby from 0. Their health matters before that point, right? But certainly when you are pregnant, then things are going through your body, they're going to the baby. And the Environmental Working Group did a study, I don't remember, a few years ago, 10, 15 years ago, and they were looking at the chemicals in the cord blood, right? And they found a couple hundred chemicals that are in cord blood, right? So all of these things matter. And that's just to say that your choices when you're pregnant, your choices before you're pregnant, all of these things affect your baby. And why wouldn't they? If they're exposed to a very high level of, let's say, what we would know, like, oh, a drug, like you're taking heroin or something, or cocaine, then these things affect the baby, right? We know this. And that's why we're like, okay, don't drink a lot of alcohol, don't do a lot of drugs, especially when you're pregnant, right? Because they can affect the baby. But we don't think about, oh, if we're exposed to lead, or we're exposed to aluminum, or we're exposed to whatever other chemical consistently, then maybe some of that goes to your baby, or maybe at least some of that affects you, which then affects your baby or the blood flow that they're getting or whatever. So if you can, having time and being at home with the baby is really one of the biggest factors in that first couple of weeks, especially. Babies are very vulnerable in those first month or two. You could be going to the hospital if you even get a cold or anything with a fever, really. I was going to send you to the hospital in the first couple of months. So the more you can be home and isolated from the virus, especially around toddlers and things like that, I think that's a good thing, especially right now with everybody being sick. To just minimize exposure is always helpful. So I think that's, if you're talking about like a newborn, something we can do to stay healthy, that's really important. For toddlers, the younger kids, let's say like 6 months. So starting with food, when you be starting around then, to me, one of the biggest things that you can do around that age is just introducing them to healthy food and real food. There's absolutely no need to introduce them to any sort of chemicals or sugar or anything with preservatives. Just get real food, mush it up, give it to them, baby-led weaning, whatever it is you want to do. Try to minimize giving them packages and pouches and all these other things. Even if it's a healthy pouch, there's still stuff in there. It's a pouch. It's touching a pouch, and it is a pouch. So, not say that you can never do it, but don't assume that those things are healthy. The only thing that that's going to be healthy-ish is something you prepare yourself. You know exactly what's in there, to whatever degree you could know it. And that's going to be the best thing for your children. And just start them off with that. They don't need anything more than that for the first, few months or years. It's just food that you prepare. Let's see where we go next. So toddlers, again, so like just getting back to the basics. So I call it the seeds of health: stress, environment and toxins, exercise, diet, and sleep. So just really starting to set those foundations for the child. And especially, I think the two big ones at that age would be, like we talked about already, diet and toxins. So just minimizing what they're exposed to in terms of chemical cleaners. Think about the clothes that you're buying for them. What detergents are you using? What products are you putting on their skin? What products are you using around your home? What's in your home? Are there plants in there? What kind of Wi-Fi signals, or where is the router? Is it beside their room? All these things, could potentially matter for their health long term. So just thinking about the setup of where we spend the most of our time, and then what you can do to make those changes. And also, again, getting them healthy food. That's not going to change throughout any age, I would say.
Yeah.
And then for the older kids, I would say social media and phones and in general screen time, just trying to minimize screen time that's not involving in schoolwork. I think social media is a huge harm these days for kids and teens, and we're on it way too much. So I think we really need to minimize exposure to that, especially at nighttime for sleep. Definitely don't want to be on it in the middle of the night. Definitely don't want phones in their room overnight. They need their sleep, and everything on there is stressful these days. And so just minimizing that exposure to the stress is a good thing. And there are several countries that are starting to lock social media apps in the night, which I don't even think would be a terrible idea to do here, after 10 o'clock or whatever, because it's always one of those things where it's like, oh, but my friends are on it and I'm going to miss something or whatever. But like, you're not missing anything at like 11 p.m. on Instagram. I'm sorry.
Right.
You don't need it. You need to sleep. So I think that we just are going to have to get tougher on social media with kids. I know that they want it, and I'm not a big proponent of like all or nothing. I think if it's out there, it's something that, we may have to expose them to at some point, but I think you can minimize it. You can delay it as much as you possibly can. And you certainly shouldn't have it at like the dinner table or when you're having family time or when they're sleeping.
I wanted to just hear your take on Eastern medicine a little bit, and how that's something that you incorporate into your practice, whether it's Ayurveda or, other traditions from the East.
When we're thinking about modern medicine or Western medicine, a lot of what we do is, here are the symptoms, we give it a name, and then we have a treatment for that, like a medication. So you have a rash, you do a steroid. You have a cough, it's a pneumonia, you give an antibiotic. Where you could have some pain, let's say on your bottom, and you can give a pain medicine, but if you're sitting on a nail, then unless you get rid of the nail, the Tylenol is not going to make it better, right? And I think that's what we don't do so well in modern medicine because we're so compartmentalized when it comes to health in terms of, you see your doctor for 2 minutes. That's all they have. They can, get in there, get out. You have a cardiologist and for your heart and a neurologist for your brain. And I think that's good to some degree because you get to be super specialized and that's really good for certain things. But we forget about the whole person and there's nobody really there to take a step back and to be like, well, maybe your diet's not the best. They're not going to spend an hour with you going through your diet and what are you eating every day? What could you do to be eating better? Oh, you're not getting enough exercise. Well, let's get you in the gym and let's get you playing soccer, whatever it is. There's nobody that's kind of bringing it all together. Whereas in a lot of the Eastern philosophies or just natural medicine in general, they spend more time. They spend more time with discussion. They spend more time looking at the whole person and focusing on the foundations, like we talk about: food, diet, exercise, sleep, stress, whether we're talking about Chinese medicine, like acupuncture, acupressure, all these things, they're just whole body systems as opposed to very specific treatments. And that is what I try to incorporate as much as I can, or just at least in the thinking process of, if you have a rash, you still might need a medication, but if it keeps coming back, well, let's think about why, not just keep giving a steroid, but, is there something in your diet that we should be exploring? And it's just a mindset that comes out of functional medicine, which is looking at root cause. And when I went to the first course that I ever took on functional medicine, I left and I was like, why was I never taught this? Like, it's so basic and common sense to think about the root cause of something, but we just spend so much time in medicine on treatments, which is important. I mean, you need to know how to identify something serious and then how to treat it, but there's something that's kind of lost in the training. And I think that's because we were so worried about disease hundreds of years ago, because that's what killed everybody. And then that's how medical school and medical training and health was kind of developed. And then, we got much better at that and we got treatments for that and we have sanitation and we're just not seeing that as often. I mean, COVID notwithstanding, but it's just not as big of an issue as some of the chronic disease things have become. But medicine never really spent the time teaching us nutrition. Medicine is important and we need it, and every part of it is super important and actually very useful. But when you have 50+% of the population with a chronic disease, then we need a system that could address that also. So the Western medicine stuff is important, but it's not really doing a good job, I think, at the other stuff. And I don't know, we need some sort of new system, whether it's like, my theory is like something like a dentist, where you go in and you have your hygienist that kind of does the whole thing before, and then the dentist after, does the actual full check. So like maybe you have to go into your doctor and you see a nutritionist for 30 minutes and then you like have an exercise counselor for 20 minutes. I don't know, whatever it's going to be set up in that way. But we can't expect doctors probably to spend an hour with every patient. It's probably not realistic, but there has to be some sort of system to identify that stuff's important, because 20, 30, 40, whatever percent of people are obese now. I mean, there's a whole report coming out right now about children and obesity and changing up. And it's like 20, I don't know what the latest numbers are. It keeps changing and going up, but we can't just throw a magic pill to fix this stuff. These are complex problems that are, some of them are at the societal level, some of them at the individual level, but we need to come together and say that this is not okay. We have to change things, and we have to change it from the societal level and the personal level. And we're never going to do that if we just keep saying, oh, well, here's a pill.
I wanted to transition into your fatherhood experience. What was it like when you saw your baby and were holding Eli in your arms and were like, wow, I'm a dad now?
Nothing prepares you to be a parent. There's no such thing. I mean, people are like, oh, it must be great to be a pediatrician. I'm like, yeah, a little bit. It's good because some of the medical stuff. Maybe I'm not so worried about certain things, but nothing prepares you for the fears and the joys and the, seeing them grow up. So it's such an amazing, magical thing. And I think that, to answer the question people ask, does being a pediatrician get you ready? No, it does not. We're in the same place as you. We're in the same place. All the things, you still have the same worries. If anything, a lot of doctors worry more, right? Then you know all the bad things. So you're more worried. So don't just assume because we're a pediatrician that we're like more prepared to be a dad. It's not true.
Yeah. Oh, wow. Like to hear that. With Sarah being a yoga teacher and experienced, in yoga, is that something that you all do together? Is there anything that you feel like you're exposing your kid to early on that's going to set him up for his life?
Yeah, I mean, I think exercise in general, we definitely go on lots of walks. We're always going outside. We're moving around. We do Pilates together sometimes yoga, all sorts of, different things. So I think he's seeing the priority of health. I mean, we cook pretty much every meal except if we go on the weekend. So we're cooking almost everything every day. He pretty much only eats that. And
Okay, good.
he helps with preparing food. He learns about food. We talk about it. So I think it's an educational standpoint of an understanding about those things. And then just seeing us, walk the walk, I guess, and going to exercise and doing those things. I think that's important because you can't expect your kid to do it if you're not doing it. You can't expect them to be healthy if you're not at least somewhat doing it, right? You can't expect them to not eat an Oreo cookie if you're eating it in the house, right? So I think it's just about living that lifestyle. It's not about pretending. It's about setting up your house, setting up your life in a way that's quote unquote healthy in terms of exercise and eating healthy. And then they'll just see it and they'll pick it up and they'll learn about it. And it's not something weird. It's just like you said, like, oh, you don't eat organic. It's not like you specifically taught them to say that. It's like, this is how we eat because this is healthier for you and you don't want to get sick. And you put it in terms that they understand. But then it's funny and it's cute when a 3-year-old or something says that. But you're not teaching them. You're like just living and they're learning, and there, I guess you're teaching them to some degree, but not really, right? We're not trying to teach them like eat this versus this because you want them to just, that's what they are.
Would you say you're a better physician now that you're a dad?
Mm-hmm. I think so. I think you're more empathetic. You certainly get the stresses a little bit more of parents. And when you're a doctor, you are not on the other side. But when you're a parent, you're on the other side. So when your kid starts to get sick and you start thinking like, well, COVID. And like, oh, your kid's getting sick and they have a sniffle. Like, is this COVID? Is it going to be severe? Is it, you start thinking about all those things, right? COVID or not COVID, whatever is RSV. You start thinking about all those things. And that makes you understand what a parent's fears are. And when they're messaging you, for something that you would maybe otherwise deem as silly or like not super severe, but you can understand why they might think it's severe based on going through it and understanding how you feel when something, first pops up. So I think that is really helpful for especially a pediatrician. I don't think you need to have kids per se, but I don't think it helps to be going through it. And I think your parents like it too. The families like it too, because they're like, you get it, what we're dealing with. So when they're dealing with being really tired or it's been a month and they haven't slept and they know that you get it and you're coming from the same place. So I think that helps to be, I don't know, living in the same world as them.
Do you have a ritual or a practice that you could share with us that helps you kind of feel centered, especially around all the stressors that you get as a parent and as a doctor?
Yeah, for me, it's just taking time away from all that. So, every day at lunch, I try to go outside and go for a walk. I try to get home and spend time with my family as much as I can. So it's just really trying to minimize work as much as possible and compartmentalize. I do lots of social media, but I also try to spend lots of time away from the phone as much as I can. So to me, it's just really setting up my day in a way that's as stress-free as possible. And I've always just tried to minimize the stress and to not worry about what I can't control anyways. And then really just exercise whenever I'm feeling a little stressed and just getting on the bike for a little bit or going for a walk. That seems to really help me.
And then where can, my audience find you and follow you?
Best places would be either on Instagram, Dr. Joel Gator, or my website, which is raisingamazingplus.com.
Oh, Dr. Gator, you are incredible. Thank you so much for sharing all your insights with us and your ongoing work. We're really, really grateful to you.
Thank you. And thank you for everything that you do as well. We really appreciate you having me on.